All right, let's switch gears here and talk health. And the government may have plans to spend more than 6 billion shillings in the management of Mpox virus.
According to the Mpox Preparedness and Response Plan by the Ministry of Health, the funds will be distributed in 3 categories to contain local, regional and national outbreak of the deadly virus.
Now, with 5 cases having been contracted or confirmed so far, Principal Secretary for Public Health, Mary Muthoni, says that the country has stepped up its preparedness and response. Our very own Safin Acheng Oma has more.
With 5 confirmed positive cases of Mpox, Kenya is ramping up its preparedness and response to the deadly virus. Speaking during an assessment tour of Ilasit border post in Loitoktok and Namanga one-stop border point in Kajiado County, Public Health Principal Secretary Mary Muthoni confirmed an escalation of screening and response mechanisms to avert further spread, especially through the points of entry into the country.
Culminatively, we have screened more than 800,000 members of public and travelers in the points of entry. Our national laboratories, we have been able to send 150 samples.
The Ministry of Health has established a national Mpox preparedness and response plan which seeks to guide coordinated public health action to stop the Mpox outbreak in Kenya and reduce the risk of importation from neighboring countries that are experiencing outbreaks, including Uganda, DRC, Burundi and Rwanda. The plan, which will adopt a 3-tier response level system, will cost the taxpayer up to 6.7 billion shillings. Local containment of the spread will receive up to 1.7 billion shillings, which will be spent on, among others, community-based surveillance, capacity building of health workers, provision of assorted PPEs, sanitation supplies, enhancing screening and putting up temporary isolation spaces. Controlling the regional spread of Mpox cases in less than 5 counties has been allocated about 2.3 billion shillings, with 941 million, which is a lion's share of the total budget, set to be spent on training of health workers. On controlling the national spread, which involves 5 or more counties, 2.6 billion shillings will be spent, out of which 191 million will be spent on sensitization of health workers, 90 million on contact tracing, 500 million on infection prevention, and 159 million on laboratory support. According to the plan, signed by PS Muthoni and Acting Director General for Health, Dr. Sultani Matendechero, high-risk areas include Busia, Bungoma, Eldoret, Kisumu, Kericho, Nakuru, Kiambu, Nairobi, Machakos, Kajiado, Makueni, Taita Taveta and Mombasa County.
We are keen on risk communication. We have enhanced our communication, and that is why I'm also here to ensure that the multi-agency teams are working very, very closely.
The Ministry of Health is working closely with county governments and other agencies to strengthen preparedness at all border points. Safin Acheng Oma, Citizen TV.
All right, on